our adult day health care program, we serve frail elders who are in need of services such as nursing, monitoring, medication administration, physical therapy, speech therapy, occupational therapy, and they spend a day here getting those services, but we disguise them as fun, so they have no idea that they're getting all these therapies, and they get a meal at noon. We have a registered dietitian who works with them on nutrition issues, and they're basically having a day which is allowing them to continue living in their homes in the evening so they don't end up in skilled nursing facilities. It also provides respite for their caregivers. And if our doors were to close, there is a very high likelihood that many of the people we serve would end up in skilled nursing institution, which cost taxpayers significantly more than what it costs to have people in these services here. Our transition coordinators are working to get them out of those skilled nursing facilities, living independently back in the community and connected to services that are going to help them remain living in the community.
The staff, they help us to maintain our health because we receive medicines here.
Rehab Services of Northern California is a small, nonprofit, mom-and-pop shop, and we've been around since 1949. We rely on community donations, grants, support, because the programs we offer are predominantly for really low income.
I come here, I do a speech group. The kind of help I get here is physical therapy. I come here because I have friends here.
So when the state does not pass a budget, we don't have months and months and months of reserves. So what happens, especially in this scenario, you had 101 days where there was no state budget in place, and so for 101 days we're providing 3 different programs to Medi-Cal recipients at no cost to the state. We're providing it free to the state. We're fronting the state money that we don't have.
I go to a women's group, crafts. We play bingo, okay, twice a week. Read, watch a movie.
We sing songs, we communicate, we do hiking in the garden. And I think it's very useful for us.
Exercise, physical therapy, and art. I'm making a parakeet outside in the mountain.
Fortunately, this year at the last minute we were able to get a bridge loan. But if we weren't able to get that bridge loan, we would have closed our doors. We wouldn't have been able to stay open.
I wasn't here. I'll be at home watching TV.
If this program wasn't here, I'd be home.
And what would that be like?
Watch TV.
If I weren't here, I'd be at home and just sitting around because my daughter works.
It will be no good for us because we will be without friends, without people that are good to us and they take good care of us. And without that problems, it will be not very good for us.
We can't continue as a small nonprofit to front the state money when they can't get it together to pass a budget.